Good day, folks. Alfie Vente here, wearing his Hawaiian shirt of Vente Pain Relief Clinic and VPRC.ca. I'm hoping you're having a great day. So you're probably wondering, why is this dude wearing this Hawaiian shirt? It's still pretty cold outside. And that is the reason why I'm wearing this shirt. So I'm trying to invite the warmth into Toronto. Right now it's not so bad, but I'd like it to be a little warmer, and I'm sure many of you guys would like that also. Anyways, forget my Hawaiian shirt. We're going to talk about this particular muscle that can refer to the base of the skull. So it's a very interesting muscle. Patients have come in and have said, Alf, I've been getting this weird headache to the base of the skull. It's kind of low grade, but it's very annoying. I'm constantly getting this thing here. It's like right here. So what could it be? This muscle that can be causing this particular discomfort and pain is actually a lot further down than the location of what that person is complaining about. It's called lower trapezius, and we're going to talk a little bit about that. So usually a patient will say, you know what, Alpha, I've been getting this pain in my elbow, I've been getting this pain in my leg and my knee, so on and so forth. And generally what will happen is that location, the muscles around the area are generally very tight, and it's usually that location that they're complaining about. But this is one particular case when people come in with these headaches to the base of the skull that is actually a muscle that's further away from that particular location they're complaining about. It happens every once in a while that it's actually somewhere else where the root of the problem is, and this is a case of that. So this muscle, lower trapezius, you can see here, lower trapezius, the picture that I drew out. This muscle, you'll see that I've drawn two X's on the bottom part here. It actually forms kind of a V. So this muscle is part of a group called the trapezius group. There's an upper, middle, and then this is the lower trapezius. I'm specifically talking about that. So those X's that you see that I've diagrammed out there are basically trigger points or trigger areas. So those trigger points are spots in the muscle that confer to other areas of the body. So this muscle here, in that particular location where those X's are, can refer, you can see that I've drawn circles around the tops of the shoulders and also that shaded area around the base of the skull on both sides. Those are two areas where this muscle can refer, especially around the base of the skull. It's very concentrated there usually. So, the person might come in and they say, yeah, I've been trying to dig in here, or I've gotten treatments to the neck, and it seems like it doesn't, or it doesn't seem like it's doing anything. It just doesn't feel like it's going away. Or maybe they feel, that there's more comfort for a little while, but then all of a sudden it comes back. So when I hear that, generally what I'll do is I'll look at other areas that may cause a sort of issue. And that, as an example, the lower trapezius would be that muscle that we're talking about for the base of the skull. So what are the common causes of this muscle becoming more triggered or irritated? A lot of overhead motions. So if you're doing things such as, you've got maybe an occupation where you bring your hands over your head a lot, that can cause some of the issues with that muscle. If you're sleeping with your hand over your head, and this is a very common one, like this, placing your hand on the base of your head here. Oftentimes, a person that complains about, for example, right-sided base of the skull pain will say that they sleep with their right hand placed on the back of their head here. Very common. Another one is an obvious one is a very bad posture when they're typing away. As many of you guys know, working from home, many of you are working from home, you don't have the proper setup that you generally would have if you were at work, which is very ironic. All of a sudden now you have bad postures, and then this muscle becomes tight and triggered. So as a therapist, how would I know that it could be this muscle that's causing the person's problem? Could it be this muscle that's the root? Well, here's a few things that I look at. The first thing is posture. That's what I always look at with when people walk in. If I'm seeing that they have a slouched posture walking in, even when I pick them up from the reception area and I notice the way they're sitting, they're usually on their phones like this, all slouched over. That's a clue for me. The second clue is the occupation that they may have. If, for example, they're carpenters or welders, they may have their hands over their head a lot, causing this muscle to become very triggered. Also, if you're doing a lot of typing, for sure, that can cause this muscle to become very tight, especially if your head's forward constantly. The next thing I do is I rule out anatomical locations or muscles around the particular area that may be causing the person's ache and pain. So I'll dig into the base of the skull, and usually what will happen is that I'll push into the base of the skull here, and they'll say, well, it hurts, but it doesn't really hurt that bad. It's not so bad. Then I'll work my way down towards the back of the neck and then the tops of the shoulders, and they might say, yeah, that's kind of painful, but it's not really too bad. And if they're saying that to me, what will happen next is that I'll go and dig into the lower trapezius muscle. Again, this muscle here. I'll push into it with my thumbs, my hands, my elbows, and generally, what I'll notice is that this muscle is tighter than most of the muscles around the area. It's actually tighter than the muscles around the local area the person's complaining about. So I dig in there, and the person says, wow, that's really tender, and I feel that's very, very tight. The other thing the person will say to me is that, wow, I feel that around the base of my skull, even though my hands aren't even on the base of the skull or even close to that area. It's somewhere further down around the mid back, lower back here. So those are the ways that help me to figure out if this lower trapezius muscle is the root of the base of the skull headaches for this particular patient or person. So there you go. That's the lower trapezius muscle. It can be quite confounding when you're trying to dig in, trying to get that the base of the skull to relax and trying to get relieve that pain. You may want to have somebody look at your lower trapezius because that could be the reason why it's chronic and why it doesn't seem to be going away, why the headache isn't going away. If you've got any questions, feel free to email us at admin@ventepainrelief.ca or phone us at 416-644-8894. Also, please like, share, subscribe. If you know that somebody can benefit from this video, please share it with them. We appreciate it. We thank you in advance. This is Alfie Vente, once again, wearing his Hawaiian shirt, trying to invite the warmth into Toronto of Vente Pain Relief Clinic and VPRC.ca. I'm hoping you're having a great day. Take care, and until next time, see you.